There is a new push now to increase medical training to use this device you see here. It's called a colonoscope, and it can save lives, especially with the Minnesota Department of Health now reporting colorectal cancer rates have nearly doubled among people under the age of 50 since the 1980s. Our Callan Gray is joining us now to share more about these life-saving efforts that are happening here in Minnesota, Callan.
Well, Leah, that increase in cancer rates among younger Minnesotans comes as there are still challenges accessing screenings in rural communities. A recent study showed more than 2/3 of all counties nationwide do not have a gastroenterologist, forcing some patients to drive distances for care. It's a gap an mHealth Fairview doctor is working to fill.
Parents at their wedding.
Michael Stoltzman shares a window into his family's history.
We got my grandma and grandpa's wedding in Italy.
Those connections over generations playing an important role in his life, especially his health.
Because of some things that my dad and grandfather had, he said, boy, we need to be proactive, preventative on this.
He's talking about a conversation he had with his family doctor about colorectal cancer screening.
He also treats my dad and my brother, so he knows a lot about our family.
Stoltzman says when he was 50, he had his first colonoscopy performed by his physician, Dr. James Hogus, who removed precancerous polyps.
If I were to wait, maybe 5 years later, something, those potentially could have grown into a cancerous polyp.
Almost half of the people that I take care of will have a precancerous growth.
Dr. Hogus tells us he's one of only about 2% of family doctors and 6% of academic family physicians performing colonoscopies nationwide. It's more typically done by a gastroenterologist or surgeon. As an assistant professor at the University of Minnesota Medical School, he's teaching the procedure to family medicine residents at St. John's Hospital. It's the only program of its kind in the state.
80% of the counties in Minnesota have a family medicine resident who has graduated from the department here at the University of Minnesota. And we know that the availability of good colon cancer screening, to include colonoscopy, that availability is limited the further you get away from our major metropolitan areas.
And Minnesota Department of Health data shows colorectal cancer rates are 12% higher in greater Minnesota than in the Twin Cities metro area.
When our residents are going to rural Minnesota, rural Wisconsin, they are bringing that capability, they are bringing that service, they're bringing that life-saving screening to those parts of the country where people might not otherwise get it.
It's going to make it way more accessible.
Stoltzman says hearing he needed it from his primary care doctor made a difference.
You're much more likely to schedule it and get it done than to put it off and maybe not do it.
The University of Minnesota Medical School is opening a rural track program in Willmar this summer that Dr. Hogus says will also train family doctors in this procedure. It's recommended people get screened once they hit 45 years old.
And now there are more options and more ways to do it.
Just making that access so much easier.
Callan, thank you.